So we talked about SARS-CoV-2 and coagulation issues and how it could decrease the number of ACE2 receptors in lungs, heart, and vessels, increasing the superoxide dismutase, which causes oxidative stress, which leads to endothelial damages in our vessels, lungs, and heart. This kind of damage increases the coagulation factors in our circulation, such as D-dimer and 1 mg factors, which increases the coagulation issues in our body, resulting in heart attack, stroke, and DVT, which is deep venous thrombosis, which could actually lead to amputation. Here are the tips to interrupt this cycle and to reverse the cycle of oxidative stress in our body. Tip number 1, 7 to 8 hours of night sleep. If we get 8 hours of night sleep, we will have 2 hours of deep sleep in which we have GH or growth hormone release from the hypophysis, which actually creates a healthy environment in our body to protect our body from oxidative stress. Also, poor quality of sleep could increase the chances of eating unhealthy food, which could increase the oxidative stress in our body, which has already been increased by COVID-19 infection in our body. Number 2, applying the stress relief techniques. When we receive the COVID-19 test result and it's positive, it causes a huge amount of anxiety in our body. And anxiety increases the discharge of a hormone called catecholamine, which can increase the pro-inflammatory cytokine production and also cause vasoconstriction, which increases the chances of stroke or cardiovascular attack. Adding lavender essential oil to our lotion and soaps and use as an air freshener or rub small diluted amounts onto your neck or feet could actually be a big help. Self-guided meditation is actually really important, and listening to stress relief music either in Google Play or any other store could be helpful. Tip number 3, having a device called pulse oximeter to measure 2 important index. Number 1, pulse, and number 2, oxygen saturation. If the oxygen saturation is more than 95, it is normal and there's no need to be worried. If it's between 90 to 95, that means we are in yellow zone and it needs to be measured repeatedly with the same device. And if it's less than 90, it needs to be addressed in the ER. And it shows that we probably have COVID-19 infection, pneumonia. And you need oxygen to increase your oxygen saturation. Tip number 4, instructions for patients with trouble breathing. Here's the instruction for patients with cough and trouble breathing. These instructions are from Dr. Suzanne Bentley, but I'm going to add a little bit to that. Number 1, 30 minutes to 2 hours of laying down on your belly. And of course, you need to put some pillow in this area. And then number 2, 30 minutes to 2 hours of laying on your right side. Number 3, 30 minutes to 2 hours of sitting up. Could be in 45 degrees or more. Number 4, 30 minutes to 2 hours of laying on your left side. And of course, you need to add some pillow whenever you're on your side as well. And then back to the position 1. Number 5, 6 ingredients to reduce inflammation and scarring in COVID-19 infection. Use the inflammation and scarring in different vital organs in a patient with COVID-19 infection. As mentioned in our past videos, we need to start zinc citrate 40 mg per day with a zinc ionophore such as quercetin, vitamin D3 4000 IU a day to improve our immune system, vitamin C 1 to 3 grams per day to improve our immune system function and to decrease the endothelial damage caused by COVID-19 infection. N-acetylcysteine 600 mg 2 to 3 caps per day to decrease endothelial damage caused by oxidative stress as a result of the attack of COVID-19 to our cardiovascular system. Last but not least, according to this article published in Wiley Library, which is a highly respected database, curcumin 500 mg per kilogram per day, or curcumin BCM95, which is high concentrated curcumin 1500 mg per day, could actually have anti-inflammatory and anti-scarring effect in COVID-19, which is exactly what we want. Tip number 6, prevent spreading the virus at home. You could avoid spreading the virus in your household by isolating yourself in a room with a bathroom. Also, you could ventilate the room by a simple task, which is cracking the window and let the droplets goes out and let the air circulate in your room. You could always clear the air in your room by using HEPA filters. Tip number 7, hot and cold showers or sauna. There are many studies showing that hyperthermia improves immune system. In this study published in PubMed titled Hyperthermia in Humans Enhances Interferon Gamma Synthesis and Alters the Peripheral Lymphocyte Population, we see the abstracts. Following in vitro mitogen stimulation, lymphocytes from hyperthermic individuals produce as much as 10-fold more interferon gamma, which is exactly what we need in COVID-19 infection, than cells withdrawn at basal core temperature from the same individuals. Induction of hyperthermia at 39 degrees Celsius, which is potentially relevant to fever in human volunteers by immersion in warm water, which is between 41 to 45 degrees centigrade, rapidly alters the cell populations in peripheral blood. As you can see in this chart, elevating the body temperature up to 39 degrees Celsius or centigrade improve and increase the number of interferon gamma up to 10-fold. Also, cold shower after this hyperthermia could improve the immune system and increase the circulation everywhere in our body. I hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friends and families. And like always, stay happy and healthy. Thanks and have a great day.